A PNP is a pediatric nurse practitioner.
We can diagnose, treat, prescribe, just like a doctor would, but with the touch of a nurse.
Kids A to C with the PNPs. W is for wetting the bed.
Hi everyone, welcome to Kids A to Z with the PNPs.
Where each week we take a closer look at some of the common health problems affecting our kids.
And we're your hosts. I'm Dominique.
And I'm Courtney. What are we talking about today?
Today is the letter W, and we are talking about wetting the bed.
Yeah, so wetting the bed is also known as urinary incontinence or nocturnal enuresis, happens in otherwise potty-trained children or children who are potty-trained during the day. It's very common and can affect up to 15% of kids by the age of 5.
That 15% decreases to 5% by the age of 10 and only 1 to 2% for our kids about 15 years of age.
So children learn to control daytime urination as they become conscious of their bladder filling and coordination to empty the bladder, otherwise known as potty training. This typically occurs by the age of 4, but nighttime potty training isn't really expected until the age of like 5 to 7.
So bedwetting in an otherwise potty trained child has a lot of different factors. It could be related to the fact that their bladder is smaller and doesn't have the capacity. Genetics, parents that had bedwetting, oftentimes their children will also have bedwetting. The bladder is underdeveloped, and sometimes there can be a decrease in a certain hormone that causes more bedwetting.
So a lot of people say that their child is a very deep sleeper, and that might mean that they can't sense when their bladder is getting full. Studies have shown that this may or may not be true. We're not sure.
Physical or emotional problems are rarely the cause of bedwetting. There are some medical conditions that can contribute to bedwetting, things like urinary tract infections, constipation, seizures, diabetes or kidney failure. But these are all things that can be easily evaluated and diagnosed by your pediatrician.
Yeah, and most of the time it's not a medical condition
Correct.
That's causing this. So the age at which bedwetting is considered a problem really depends on the family and the family's expectations. Some families are concerned if their child isn't nighttime potty trained by the age of 4, and others aren't concerned until it starts to interfere with social activities like sleepovers and such.
It's important for us as providers and parents to know that bedwetting is very common, and it will go away with time and as your child ages. And at no point should your child be punished for bedwetting regardless of their age. So what can we do, or you do, if your child is wetting the bed?
So most children should be voiding like 4 to 7 times a day. So make sure that your child is voiding or urinating regularly, and especially just before bed. If your child wakes up during the night, take them to the toilet.
Avoid sugary and caffeinated drinks with your child. Also keep track of how much fluid your child takes during the day. It's been recommended that your child take 40% of their intake in the morning, 40% in the afternoon, and only 20% into the evening.
It's also helpful to put night lights in the hallway and in the bathroom so your child can make their way to the bathroom at night. And we should really try to avoid the use of like pull-ups or diapers when the child is sleeping at home, especially over the age of 8. They can, however, be used if they're going somewhere for an overnight visit.
Get a waterproof mattress pad. This can protect the mattress. And then also make the bed in layers. So you can use like a pad layered with a sheet or a towel when your child goes to bed. And if your child does have an accident, encourage them to get up, go to the bathroom right away before changing into dry pajamas, and then they can remove the wet layers and then have a dry layer to sleep on. This kind of avoids remaking and doing a whole set of laundry in the middle of the night, and they can go right back to sleep. Then in the morning, I think it's important too to involve your child in the cleanup process. So having them help take off the sheets and putting them into the laundry.
And also don't tease your child or let your siblings tease your child about wetting the bed. Again, it's not their fault, and they definitely shouldn't be punished or, you know, feel bad about it.
There are some medications that can be prescribed in rare situations. However, it's important to make these modifications that we've mentioned, and most children will outgrow this behavior. We do, though, at Children's have a bedwetting clinic, so you can always talk to your pediatrician or call us to make an appointment.
So I think that wraps up W is for bedwetting, and next week we will be back with the letter X, and X is for
X-rays, CT scans, MRIs, and ultrasounds.
Yeah, so we're going to take a look at these different tests and kind of let you know the difference.
Yeah, and as always, leave a comment, give us a share, send us an email if you have any questions, kidsa2z@dmc.org, and we will see you next week.
Thanks for watching.